Hello everyone. Thank you for joining me live today. I'm so happy to be back on this live session. If you have watched my previous lives, welcome back. And if this is your first time, I am Rashmi, clinical nutritionist and diabetes expert. Today, I want to ask you one simple question. Have you ever wondered why someone can have normal blood sugar for years and still get diagnosed with diabetes suddenly? Have you come across any of such situations? What do you think? Diabetes really started suddenly? It was diagnosed suddenly, or it was diagnosed just that day? Or the story began many years ago or many years earlier? That's exactly what we are discussing today, and we are trying to understand the diabetes story. In my previous sessions, we learned something important. Insulin is not just another hormone. It is the hardest working hormone in our body, as it gives energy, it builds muscles, it can control our hunger, it protects our liver also. So today, let us answer another question. If insulin is so intelligent and so hard working, why did it suddenly stop working properly? Have you ever come across such situation where everything is normal, blood sugar is normal, and suddenly the blood report says the diabetes has been detected? Before I explain, answer one more question honestly. How many of you have gained weight around your waist in last few years? You feel sleepy after lunch frequently. Maybe daily after lunch you feel sleepy. You feel hungry again and again within 2 hours of having your meals. You find it difficult to lose weight. You have been suddenly told that you have fatty liver, but your blood reports are all normal. Especially the sugar reports are normal. Even if one of these sounds familiar, you drop yes in the comments. Yes, because today's live is not just about insulin but about you, your body, your health. Now, let us travel back thousands of years. Imagine our ancestors, or even further back. People didn't have refrigerators, they didn't have Swiggy, Zomato, or any instant snacking service. They ate, they worked, they walked. They used their muscles, and sometimes there were long gaps between the two meals. What happened inside their body? Food came, insulin increased, glucose entered the muscles, energy was produced, and it was used efficiently. Then insulin went back to the normal level. Body rested. Everything was working balanced. Everything was beautifully balanced. Now let us imagine our lifestyle. Morning tea with biscuits, breakfast with tea or coffee, mid-morning snacks, heavy lunch, again tea time, tea plus snacks, dinner followed by dessert, then late night munching. Tell me honestly here, how many times are we asking our body to deal with heavy food? Almost the entire day. Every single time we eat, insulin rises again and again to manage the food we have eaten. Now, let me give you another example from day-to-day life. Imagine your phone. You charge it to 100% and use it efficiently. Then when it drains off, you charge it. This is normal cycle. Now imagine you keep the phone charging all the day without letting the battery to drain off completely. without that cycle. Soon what happens is the battery does not perform as it was doing earlier. This is similar to our metabolism. It works best when there are periods of activity and periods of rest. When insulin is constantly being called into action, the system gradually becomes inefficient. Now imagine another situation. For example, someone is ringing your doorbell. First time you open the door, second time you open the door, third time you again open the door. But if somebody is keeping on ringing the bell every few minutes, eventually you stop responding. Is the doorbell stopped? Has the doorbell stopped working? No. You have stopped responding. Exactly same thing happens in our body. Insulin is knocking the cells, but cells have become less responsive, and this state is called insulin resistance. This is the root cause of type 2 diabetes. This is the reason why people are turning suddenly diabetic. Here is another interesting part of the story. Pancreas notices the cells are not listening. So it says, no problem boss, let me make more insulin. It makes more and more insulin than what is required. Now here is something that surprises every diabetic patient I meet. Your blood sugar can still be normal during this stage. Print this in your mind. Your blood sugar can still look normal in this stage, but your pancreas is already overworking, sometimes for years. That's why I say type 2 diabetes doesn't appear suddenly. It develops silently, long before HbA1c rises, long before your blood sugar rises. The body starts whispering. It gives you signals: large waist, more belly fat, repeated cravings, sleepiness after meals, difficulty in losing the weight, belly fat, fatty liver, thyroid, high triglycerides, higher level of cholesterol in the body. These are the whispers, and these whispers becomes louder and louder. Most of them we ignore because sugar report says it is normal. Can I ask you one simple question again? How many of you were told, don't worry, your sugar is slightly higher, but you have been struggling with these symptoms? You have been struggling with higher weight for many years. If you have come across such situation, you can comment me in the chat box. This is exactly what I see every day. Patients come to me saying, Madam, I have been diagnosed with diabetes suddenly. But when we sit together and go through their story, the warning signals have been there for at least 5 years, sometimes even for 10 years. That's why I don't believe in treating only blood sugar. I believe in understanding the person as a whole. Your eating pattern, your sleep, your stress, your activity, your waist circumference, your weight, and then your blood reports. Because no two people with the same sugar number will have the same metabolic story. And that's exactly why I created my metabolic reset program. The first step is not giving you just a diet chart to follow. The first step is to understand why your metabolism is struggling. Is it because of your meal timing or meal pattern? Is it because of excess abdominal fat, poor sleep, your stress, your muscle loss? We understand the reason. The plan becomes more meaningful and it will last long. The results will be easy to achieve and will be long lasting. And here, what I would like to request you is, if today's live made you think maybe this is happening to me, don't ignore that thought. Send me a DM with the keywords insulin check. I will share few simple questions. Then we'll have a look at your blood reports if you have them. And then I will tell you whether your metabolism needs a deeper assessment. And if you are really fit. I will explain how my metabolic reset program can help you. There is no pressure, just clarity. Thank you so much for spending this evening with me. And before I go, remember 3 M's of diabetes discipline. Monitor, measure, modify. Monitor your habits, measure your progress, and modify that what is not working in favor of you. Small changes done consistently can completely change your future. Thank you. Take care. Stay healthy.